And welcome everyone. And as I said, today I'm going to review the revised nurse practitioner entry-level competencies 2023. So just to give you a little bit of background where the revised NP ELCs came from. And in February 2020, the Canadian Council of Registered Nurse Regulators, made up of executive directors of each of the nursing jurisdictions, agreed to implement the endorsed 6 basic elements of a model for nurse practitioner regulation in Canada. And those 6 basic elements involved having entry-level education, having 1 national exam, having principle-based or principles to outline standards of practice, registration and renewal, and continuing competence. And a steering committee comprised of representatives from 10 jurisdictions were commissioned to oversee the national initiative. And CCR&R called this initiative the Nurse Practitioner Regulation Frameworks Implementation Plan Project. And we commonly call it the NPR-FIPP. That's a mouthful, but basically a key priority of this group was to update the NP entry-level competencies, which was going to drive future NP entry-level education, and along with a nurse practitioner practice analysis would inform 1 national NP examination. And another deliverable from this project was that we would be changing to 1 category of practice. Now, we don't refer to it as a generalist model, but through the jigs and reels, people have referred to it as the generalist model, so that it would be based upon the same type of model that our registered nurse model of practice is based upon, that everyone graduate as a 1 category of nurse practitioner. Then through this project, another deliverable is that we needed to move forward with a new national exam, that we would need to revise the entry-level competencies that were established in 2016. So a steering committee or working group was established, and it was called the Education Subcommittee. And we were established in January 2021. And myself and my colleague, Donna Cook, who is with the College of Registered Nurses of Saskatchewan, were co-chairs of this committee, and we were tasked to have as a deliverable a revised set of NP entry-level competencies. And we have representation from several other regulatory bodies that came from the steering committee, but also members from who these jurisdictions identified as subject matter experts. And we did have a nurse practitioner, Lynn Miller, who was the subject matter expert, and also regulatory subject matter experts on this education subcommittee. CCR&R also hired a competency consultant to support the revision of the entry-level competencies. So if you want to know more information on the NPR-FIPP project and the development of the NP ELCs, you can go to CCR&R's website, which I have at the bottom of this slide. And you can Google CCR&R and it will come in, come up, and just click on it and you can find all the information on this project. So I'm just going to now look at the profile of a nurse practitioner at entry to practice. And a entry-level nurse practitioner is an RN with additional experience and nursing education at a master's level. They can autonomously diagnose and manage care across the lifespan in all practice settings. They are advanced practice nurses, and they use their in-depth knowledge, nursing knowledge, and experience to analyze, synthesize, and apply evidence to make decisions. They apply theory and knowledge from nursing and other disciplines to provide a comprehensive range of essential services grounded in professional, ethical, and legal standards within a holistic model of care. Entry-level entry to practice or entry-level NPs work across all domains of practice. They also provide leadership and collaborate within and across communities, organizations, and populations to improve health and system outcomes. And they assume the role as the most responsible provider in some settings. So this is just to give you that beginning profile of a nurse practitioner when they graduate from their NP program. So what are entry-level competencies, and in particular, what are nurse practitioner entry-level competencies? And entry-level competencies reflect the foundational knowledge, skills, and judgment required of nurse practitioners to provide safe, competent, ethical, and compassionate care at entry to practice. They are competencies that new NPs must possess to be competent when they begin practice. And they set out the entry to practice expectations. They also help inform nursing curricula. So NP education and curricula is aligned with these competencies, and that becomes part of the educational approval process. And nurse practitioner students will obtain all of the entry-level competencies by the end of their NP program. And I assure NP students when I go into their first year class and talk about standards and entry-level competencies, that by the end of their program, you will attain all of those entry-level competencies. And even though NP roles and responsibilities may vary by context and client populations, NP ELCs are competencies that all new NPs must possess to be competent when they begin practice. And what are the purposes of nurse practitioner entry-level competencies? Well, nurse practitioners' ELCs reflect the knowledge, skills, and judgment required of nurse practitioners to practice safely and ethically. They are used by regulatory bodies for a number of purposes, including but not limited to academic program approval and recognition. So as part of the educational approval process, we do have a educational approval process, and is built upon CNO's program. And last year, the NP program, the Masters of Science of Nursing NP option, went through the educational approval process, and they received a 7-year approval status. And they've also been through an annual review report submission. So the program did extremely well. And the program, as one of the indicators in that process, is that the school details how the entry-level competencies are incorporated into their curriculum. NP ELCs are also used to assess internationally educated applicants. They're also used for the assessment of applicants for the purpose of re-entry into the profession. So if a NP has elapsed membership and has not been practicing, they do not have 900 hours in 3 years, and they've been out of the profession for 5 years, then we would use that in that assessment. They also are used as practice advice or guidance to clinicians, and some jurisdictions use them as a reference for professional conduct matters, particularly if there's an allegation laid against a nurse practitioner very new to practice. Then we would use those to determine what would be expected of a nurse practitioner on entry to practice. They're also used for public and employer awareness of the practice that's expected of nurse practitioners when they enter into practice after obtaining a license to practice. So just to tell you a little bit more about the NP Regulations FIPP project. And as I said, one of the deliverables that came out of this project was the revised NP ELCs. And in Newfoundland, our college council approved these at their February council meeting. So they have received approval by council. So The Canadian Council of Registered Nurse Regulators, as I explained previously, made up of the ADs, first published entry-level competencies for nurse practitioners in Canada in 2016. And I was a part of that process. I came in a little later because I didn't start until September 2015. But from a practice analysis that was conducted in 2014 to 2015, the first national NP ELCs were approved across all jurisdictions and implemented in 2016. And in 2020, CCR&R initiated a process to update the ELCs, and ELCs are revised periodically to reflect evolving population needs, health systems, and NP practice. And that was what was found in the steering committee, that from 2016 to 2020, NP practice had evolved immensely. There was a lot of changes in practice and new trends. You know, there was medical assistance in dying. There was cultural safety and humility. There was virtual nursing practice, medical assistance in dying, just to name a few. And so it was, I guess, identified that we really needed to revise the current NP ELCs in order to move forward with the elements of NP regulation that that was agreed upon, and that being one category of practice and one national registration exam. And the national NP ELCs would also reflect interjurisdictional consistency to support workforce mobility requirements of the Canadian Free Trade Agreement. And what that means is that, you know, it would create harmony between the different jurisdictions, and so that there would be greater portability from moving from one jurisdiction as another if you are you know, licensed in the same category of practice and have the same nurse practitioner entry-level competencies. So it would you know, facilitate consistency across the regulation processes. Also, the current revisions of the NP ELCs were informed by an environmental scan, a literature review, and stakeholder consultation. So, so there was quite a bit of work that led to the development of these NP ELCs. So now I'm going to talk to you a little bit about what was done to inform the development of the revised NP ELCs. Well, there was a lot of stakeholder consultation. I can assure you that starting last January, from January 2022 to July 2022, there was a lot of activity in stakeholder consultation. And before that, there was an extensive environmental scan that was done across North America, the UK, New Zealand, Australia. So there was quite a large environmental scan and literature review. And then we started with stakeholder consultations, and we started off with the competency consultant to do focus groups consultations. And we met with nurse practitioners from each of the jurisdictions. We met with nurse practitioner educators and nurse practitioner regulators. So we have representation from the regulatory bodies as well. And we did a number of focus groups with these individuals. We also then also did focused interviews with subject matter experts. And the subject matter experts were individuals that could give voice to competencies that were important to addressing anti-racism and Indigenous peoples. And we used a 3-stage process to engage with expert panelists on issues such as Indigenous issues, the 2S LGBTQIA plus, and groups that experience racism. And then as I said, we did it in 3 stages. Stage 1, we asked for general advice of what they would see needed to be in the NP ELCs regarding these issues. Then stage 2, we asked for targeted advice on a draft of the NP ELCs. And then stage 3, there was further advice on what changes needed to be made to the draft NP ELCs. And we had a total of 9 individuals and 5 were NPs. Some individuals were interviewed more than once, and some brought multiple perspectives to the conversation. And again, if you want to know more about this, I would encourage you to visit CCR&R's website under NP ELCs or the NPR-FIPP sections of the website for project updates, but also there is a development report there that will give you more information on what was used in the consultations. We also did a national NP ELC competency validation survey. So there was a survey emailed out to all nurse practitioners, and I'll go over some of the results that came out of that survey. We also had regulatory body input on the drafting of the ELCs. And then there was many sessions where there was input given on what changes needed to be done. We also did jurisdiction-specific stakeholder consultation, and this was made available through website and email surveys and focus groups. And we did a number of focus groups in June and July of key stakeholders in Newfoundland. And that consisted of professional practice, the Newfoundland and Labrador Nurse Practitioner Association, the nurse educators, and other key stakeholders. We also had consultations with national NP organizations. As a part of the NPR-FIPP program, project, we also have a stakeholder advisory panel, and these are national groups that are connected with nurse practitioner practice. For example, the Canadian Association of Nurse Practitioners, they sit at it, CASN, the Canadian Association of Schools of Nursing, the Canadian Nurses Association, the chief nurse of the country sat at this table. So there's this panel that are experts, and they provided consultation on the NP ELCs as well. We also gave an opportunity for the public to have input, and there was a survey that was posted on our CCR&R website. We also received public comments versus the CCR&R website that people had an opportunity to provide comments. And then we also involved our staff internally. We did a focus group on their feedback as well. So as you can see, there was a large amount of stakeholder consultation to lead to the revised NP ELCs. So just to give you some of the results that came from the NP validation survey, which led to the revisions and the final draft of the NP ELCs. So there was a survey that was done in English and French that was distributed to over 7,600 nurse practitioners, and we received a 12% response rate. And overwhelmingly, the majority of respondents completed the English survey. We had 10 individuals participated in the French survey, but only 4 completed it. And all jurisdictions were representative in the survey responses. Ontario had the highest volume with 571 respondents, but that makes sense. They had the largest number of nurse practitioners licensed in Canada. And most English respondents were from an urban setting. There was 72%. The hospital practice setting, there was 32%, and in direct care, it was 98%. And the majority of the French and English respondents were employed and working full-time. Greater than 1,800 comments were received from English respondents, and an additional 30 comments were received from 2 French respondents. Over 1/2 of English respondents had more than 10 years of NP experience, and that accounted for 56% of the respondents, while 5% indicated they had more than 2 years, but less than 3 years of nurse practitioner experience. And the majority of the French respondents had over 5 years of nurse practitioner experience. There was a strong correlation between responses of nurse practitioners with less than 2 years of NP experience and those with more than 2 years of experience. We also had fewer than 30 of the 154 performance indicators were flagged for review on the survey rating scales for frequency and importance in practice. So from that survey, it showed that we were pretty well on the mark with what we had identified as entry-level competencies, but we had to do further consultation and further follow-up. And just to note that in Newfoundland, we had 36 nurse practitioners who completed the validation survey, or 2.8% of all nurse practitioners in Newfoundland completed the validation survey in Newfoundland and Labrador. So just some principles or assumptions that were used to inform the revised NP ELCs and NP practice. And I guess it's really important to note that nurse practitioner practice is dynamic and evolving, and the NP ELCs encompass and build on the competencies of an RN and establish the foundation for NP practice. So these were things that were leading the background of the development of the NP ELCs. And that was one of the principles that we wanted to do, was not repeat or build upon or repeat any of the RN competencies. We would build upon the RN competencies to reflect the advanced competencies of NP practice. And it's really important to note that all NPs are ultimately accountable for meeting the ELCs throughout their careers. And nurse practitioner is considered entry level on initial registration or licensure. And entry to practice NPs draw upon a theoretical and experiential knowledge base shaped by their RN practice and their NP education program. And entry-level competencies establish the context for autonomous, independent, and advanced NP practice. And that's what we were trying to reflect in the revised NP ELCs. And that was one of the main principles that's outlined in the preamble, is that nurse practitioners are autonomous, independent practitioners, and use advanced competencies in their practice. So just some principles and assumptions for entry-level NP practice. So an entry-level nurse practitioner. So this is what would be expected by employers. This is what the public would expect of a entry-level, a new graduate from NP practice. It would be what a manager could refer to when they're seeking to hire a nurse practitioner, a newly graduated nurse practitioner. This is what we can expect. Well, an entry-level nurse practitioner has a strong foundation in nursing knowledge and theory of health and sciences, humanities, research, and ethics from formal graduate level programs. So the entry to practice education level for a nurse practitioner currently is at a Master's of Science of Nursing level. Is at a master's level. Entry-level nurse practitioners practice autonomously within legislation, practice standards, code of ethics, and scope of practice in their jurisdiction. They work within their individual scope of practice, and they seek guidance when they encounter situations that are beyond their individual competence. They are prepared to practice safely, competently, compassionately, and ethically with all people across the lifespans, with all clients, individuals, families, groups, communities, and populations in all practice settings and across all domains of practice. And this is really important to note in these revised NP ELCs. They address all domains of practice, and we have competencies and performance indicators that are in tune with those domains of practice. And the entry-level nurse practitioner uses evidence and applies critical thinking throughout all aspects of practice. So these are some of the assumptions that you can expect of an entry-level nurse practitioner. So this is what a revised nurse practitioner ELC document looks like. This is what was presented to Council for approval in February, and it was approved by Council overwhelmingly on February 23rd, 2023. This document can be found on our website. And when you go into our website, up on the top right-hand corner, there is a hamburger or a menu lines is 3 disorder lines. If you click there and go into education approval, there you will find the link and you click on entry-level competencies for a nurse practitioner, and that's where you find that document. You can also find it under our resource directory, and it would be under a practice, under a standard there under the categories that you're trying to find that document. Or you can use the search engine and to put in nurse practitioner entry-level competencies. So the revised ELCs were developed using a role-based framework that represents the multiple roles nurse practitioners assume when providing services in any practice setting. And they are an interconnected set of competencies and indicators. And so basically how we have it is we have a role-based framework that is similar to the RN and RN ELCs. So you have a 3-tier approach. We have a role, and we have 5 roles, and we have a role descriptor under the role title. Then we have a competency statement, but under each competency statement, we have performance indicators, which further defines what that competency is and what would be needed to meet that competency statement. And the nurse practitioner ELCs encompasses and builds upon the RN ELCs, but focusing on distinct entry-level advanced competencies for nurse practitioners. And these competencies are accompanied by performance indicators. And you know, it's really important to note throughout this document is that nurse practitioners will assume at any time more than one role. So they're in each, whatever role that they're having incorporated in their practice, then they would have those indicators, performance indicators, that would be expected. And the NP can play several roles at one time. And most importantly, the ELCs that you see in this document represent the advanced competencies of NP practice. And in all of the domains of practice, they would be representing the advanced competencies of the NPs. Anything that would be an RN, because NPs are are registered as an RN and licensed as an NP, they are an RN. Those RN competencies would have been obtained in their RN education program. So inside the document, you will see the structure of the revised NP ELCs. You will see 5 roles, and under each of these roles, you'll have a role descriptor. There are 29 competencies that are grouped under the 5 roles, and we do have a visual that depicts the nurse practitioner entry-level competencies encompassing and building upon the RN entry-level competencies. So the gray petals are the RN roles that are identified in their RN ELCs, but in this document, the green is representing the 5 roles that the NP has in their ELCs. Under those 29 competencies, we have 159 performance indicators. And it's important to note that these indicators use updated terminology, and they address the new trends and competencies in NP practice that evolved into NP practice since 2015, 2016. Now we're going to have a quicker look at the 5 roles. So the first role that's identified in the revised NP ELCs is clinician. And under clinician, the role descriptor is as such that nurse practitioners deliver safe, competent, compassionate, and ethical care across the lifespan with diverse populations and in a range of practice settings. NPs ground their care in evidence-informed practice and use critical inquiry in their advanced diagnostic and clinical reasoning. So you'll see the word advanced because that's what we're focusing on. And under this role, there are 17 competencies with specific performance indicators. And they are organized because clinician is a major role in nurse practitioner practice if you're in frontline clinical NP practice, and they're organized under headings. So the first heading is assessment, diagnosis is the next, then management, then counseling, which you'll see is a new NP ELC, and then the transition of care, discharge planning and documentation. And under that last one, you'll see statements about, admitting and discharge ELCs. We wanted to encompass the new trends and competencies in this role. So we did, through our environmental scan, we realized that there were a lot of new trends that need to be incorporated into the NP ELCs. And I just named some of these. For example, there's virtual care, urgent and emergent and life-threatening care, for example, airway management, intubation. Counseling was a big one. So, there's performance indicators that address trauma and evidence-informed care and intergenerational trauma, gender identity, sexuality, and personal expression, point-of-care tests, pharmacology history to include natural health products and traditional medicine, polypharmacy and de-prescribing, communication and information technology. In practice now, there is the electronic health record or in the electronic medical record. There's artificial intelligence that is being incorporated into practice. There's performance indicators to address harm reduction and substance use disorders, including, the ability to prescribe Suboxone and Methadone. There's admitting and discharge ELCs. There's ELCs to address advanced care planning, palliative care, and end of life, including medical assistance in dying, because this is not in the old ELCs. We also incorporated self-employment and performance indicators that talk about billing and advertising practices and the custodian of health information. We have a large number of MPs across Canada now moving into self-employment, so that, at entry to practice, MPs are setting up their own businesses. So that was identified as a requirement to include in the ELCs. The next role was leader, and under leader, nurse practitioners demonstrate collaborative leadership within the healthcare setting system, locally, regionally, nationally, and globally. They are leaders in the development, implementation, and delivery of continuity-based, person-centered care. MPs serve as role models and mentors, demonstrating leadership to advance continuous improvement of client outcomes and health systems, and nurse practitioners contribute to implementing and maintaining a high-quality healthcare system through innovation and policy development. And they strive for cultural of excellence and facilitate the development of effective teams and communication within complex health systems. So under this leader role, there are 3 competencies with specific performance indicators. And the new trends or competencies that were incorporated into this role included enhanced safety expectations, leadership and health promotion, and the development of primary, secondary, and tertiary disease prevention expectations. We have ELCs that discuss disaster and pandemic planning. Particularly, we were right in the middle of COVID-19, and so pandemic planning was certainly practice that MPs were heavily involved in. We also have performance indicators that address global public and population health trends. This one, the new role of advocate, was heavily informed by our subject matter experts that I spoke about before. And under this role, the role descriptor is as such: MPs influence and improve the health and well-being of their clients, their communities, and the broader populations they serve. They address health issues related to health inequity, culture, diversity, and inclusion to improve health outcomes and lead advocacy efforts to change policies and legislation. And under this role, there's 6 competencies with specific performance indicators. And you will see that in this role, there is a competency that addresses the Indigenous peoples. And that was what was in our subject matter expert focus groups. That was what that was identified by Indigenous peoples, that there should be a competency that addressed their unique issues. So you'll see a full competency that addresses that. So in this role, the new trends and competencies that were incorporated address cultural safety and equity, diversity, and inclusion. There's competencies that specifically address cultural safety, anti-racist for Indigenous people, And this integrates and facilitates the use of the involvement of cultural resources, families, and others, such as community elders, traditional knowledge keepers, cultural navigators, and interpreters. So in your entry-level education, where possible, if you can bring in elders, knowledge keepers into your classroom or expose nurse practitioners during their education program, that would be phenomenal. You would also encourage, in these ELCs, we encourage incorporation of cultural and healing practices and ways of knowing into the NP practice. And we also added self-awareness expectations as well. The next role is educator. So we describe the educator as NPs develop and provide education to a wide variety of individuals, groups, communities, and organizations to enhance knowledge and influence nursing practice, health outcomes, and systems change. So it expanded from being the education of the client to larger stakeholders such as groups and communities and organizations. And under this role, there are 2 competencies with specific performance indicators. And this role recognized that competencies went beyond person-specific education to include education of groups, communities, and population. So that was one of the expansions of this role from the RN. The last role is scholar, and scholar role description explained that NPs seek out, participate in, and demonstrate leadership in research activities to evaluate, explore, and advance knowledge and support knowledge translation in all domains of practice. And once again, this role had 2 competencies with specific performance and indicators, and this role focused on the participation and leadership in activities related to research and knowledge translation. So this is just a snapshot of the 5 roles and some of the competencies that were incorporated under each of the 5 roles. So the next steps will be that now that they have been approved by council, the Faculty of Nursing has a copy of these revised NP ELCs, and they will be looking at how they will incorporate and align their curriculum to these revised NP ELCs as part of the educational approval process. Timelines are being developed, and we will communicate those to the Faculty of Nursing when the program has to have them incorporated in. But we're awaiting the development of the one national registration exam. So we will be in contact with the schools, and we've already had meetings with the schools to look at that. But when these will be fully, the expectation, and we'll be graduating the one category of practice and one national exam being available. It's foreseen to be in the next 2 years, and we are now currently working on a legacy plan to determine what will be the future of those who are in family all ages, pediatric and adult categories of practice. So those are some of the things that we'll be working on in the very near future. So I just want to end the presentation by just going over some of the ways that you can get in contact with us. We do have a Facebook account. So if you can like us, you'll be able to receive information from the college on education sessions like today, any types of consultation that we're looking at. We also have a Twitter account that you can follow our tweets. We have an Instagram account. We also have a YouTube account. You'll be able to watch this recorded education session through YouTube if you know the title, or you can go in under our website under our archived events. The next bullet is our physical location. I have my telephone number there for the main line and the 1-800 number. We also have a new website, and here's the website now. It's www.crnnl.ca. And as a nurse practitioner, or if you are licensed with the college, we do send out practice team emails. This is information from Peggy and I. So please don't delete it. Please read it, because you're getting important information from a regulatory perspective, but also clinical information. Because as part of that practice team email, each the first Monday of the month, we send out a newsletter called Notes from the Practice Team that has relevant information on NP and RN regulatory information, but also very clinical information that we've received from key stakeholders. So I just wanted to make you aware of those mechanisms to stay connected with us and have updates from CRNNL.